So my patient comes in with a positive VDRL test, prolonged PTT, and also multiple spontaneous abortions in the past. I hope you're thinking antiphospholipid antibody syndrome. This is autoimmune. You make antibodies against the VDRL test, which is why it comes as a false positive. And it also interferes with coagulation tests sometimes, which is why you have an elevated PTT. I usually try to confirm my diagnosis by looking for some mild type of thrombocytopenia. And this is because the platelets and the endothelial cells in your body, they create a more coagulable state. So what if the patient doesn't have spontaneous abortions, or what if you have a male? Well, normally they actually present to the ED or to you inpatient as an arterial or even a venous thrombosis, because again, this is a hypercoagulable state. This is also the same pathophysiology why you have pregnancy losses. If the patient's pregnant, give them low molecular weight heparin, and I remember this because the baby is low weight. Otherwise, just start them on anticoagulation, such as IV unfractionated heparin. But if the patient is really high risk and they have no desire to be pregnant, it's okay to give them long-term oral warfarin. And if the patient does want to have children in the future, again, low molecular weight heparin plus aspirin. This helps prevent miscarriage. Although step 2 is kind of moving away from having very obvious findings or word recognition type questions, if you do see a patient with splinter hemorrhages, do think about antiphospholipid syndrome. Remember, if the patient actually has syphilis, give them benzathine penicillin, and you want to confirm giving an FTA-ABS test. Don't forget that also antiphospholipid syndrome shares the same antibodies as lupus, and lupus is treated with corticosteroids or prednisone. But again, when you think about lupus, you also want to think about rheumatological diseases such as nephritis or arthritis also presenting in the patient. And also a patient with lupus will have blood or protein in their urine typically. And remember that steroids will not help you in treating antiphospholipid syndrome.